All right, this is going to be your standard radius and ulna fracture repair for discharge instructions. We're going to just walk through these discharge instructions. You can see here at the top, I've included the office phone number, but my personal cell phone number as well. So if it's nights or weekends and you have an issue, a question, you can text me, you can call me. If you have a problem with the incision, you can take a picture and send me a text. But for the next 6 to 8 weeks, we're going to confine to either a crate, a large kennel, or a small room. All right, I don't want any jumping, running, or rough play. All activity is either held, crated, or confined, and leash walked. And on these leash walks, initially for the first 2 weeks, I just want us going for a 5-minute walk to use the bathroom. But on this walk, the slower we walk, the more off balance they are, and they're going to be forced to using his leg. I want them using the leg. I just want you on control, and we're going to use the leash to control it. I'll see you back in a couple of weeks. We'll modify the activity based on how we're doing. Also want you icing the leg, and just take an ice pack and we're going to put it on the leg and hold it there for about 5 or 10 minutes. Some dogs will let you do it, some dogs won't. If it's a huge struggle fest, forget it, don't do it. But if we can get it done for the next 3 days, it'll help with swelling and bruising, okay? There is a skin incision, and we'll see you back in 2 weeks to check out the incision, make sure it's healed, and then we'll also modify activity based on how we're doing. Just check out the incision every day. If there's a problem or you're worried about it, take a picture, send me a text. I've included the number. He's coming home with one of those cones. We don't want him licking at the incision. If we lick the incision, we can cause an infection, and that could really hurt us, okay? And then we'll take some x-rays at 6 weeks after surgery to assess healing. Based on what the x-rays look like, we'll modify activity. And then medications, we've got a couple here. Just look through this. They're going to change dog to dog, but standard, an NSAID that's going to help with discomfort. We're going to use that as directed. All right, gabapentin, it's going to help with discomfort as well. You can use that as an every 8 or 12-hour drug. Here in the hospital, we give medications on a 6 a.m. and 6 p.m. schedule for drugs that are every 12 hours. And so we'll be due for medications either at 6 p.m., okay? And then you may or may not have an antibiotic on your discharge instructions, but just follow the medications as we go through. And again, any questions, feel free to give us a call.